Okay, I'm going to look at my MAR in my original order sheet. I'm going to double check the patient's name, any allergies, their date of birth, make sure all the drugs are correct with the right dosages. So we have Humulin NPH, Humulin R, and ceftriaxone. Everything matches up, so now I can go to the Pyxis, log in, wash my hands. I'm gonna first pull up the Humulin NPH, get that out of the Pyxis, look, make sure there's no expiration date, or that it hasn't expired, it's the correct drug. Next to Humulin R, same thing, look at the expiration date and the drug name. And next, the antibiotic ceftriaxone, same thing. Great, everything matches up correctly with the MAR, double check, perfect. Now I'm gonna gather all my supplies, gather my necessary syringes, my alcohol pads, everything. Great, now I can go to my patient, logged out of the Pyxis. Hi, I'm Natalie, I'm a Marian University nursing student. I'm here to administer some medications. I'm going to raise their bed, wash my hands, apply necessary PPE. I'm going to scan their band, verify name and date of birth. Perfect. So my first medication is going to be administering insulin. I already checked your blood sugar, it's 180. So we got to administer this medication. First, I'm going to get the 2 insulin vials, clean them real good, let it dry. The NPH I'm going to roll in order to mix, do not shake. Great, it is a high alert medication, so I'd have another nurse double check with me. Great, now I'm going to mix the medication. So since we need 15 units of NPH, I would pull 15 units of air first and directly insert that into the vial. Now I would pull 13 units of air for the Humulin regular. 13, perfect. And I would insert that again directly into the vial. Flip it over. Oh, I would insert it, then flip it over. Okay, pulling 13 units. Carefully, if there were any bubbles, I'd get the air out. Great. Now I'm going to pull the 15 units of the NPH. And that would add up to 28 units of insulin. So, great. Now I'm going to set those to the side. I'm going to scoop up the needle. There we go. Now we're going to do this subcutaneously today, so I could do this in the dorsal gluteal of the anterior thigh, the abdomen, or the lateral upper arm. We're going to do this in the abdomen, if that's okay with you. Yes, perfect. I would do it 2 inches from the umbilicus or 2 inches from any wound or incision. Clean it real well. Circular motion, about 2 inches out. All right, I am now going to pinch the subcutaneous skin. I am going to inject at a 45-degree angle. If they were obese, I would do a 90. I'd insert it, let the skin go, and then inject. Slowly take it out. If there was any bleeding, I would put a bandage, scoop up my needle, put it in the sharps container. I would ensure that the patient knew about side effects, so that would be hypoglycemia, and they may experience a little bruising or tenderness. Now, that is that. Now I'm going to do the ceftriaxone. So this is an antibiotic from the dog bite. I'm going to pull up 0.5 ml of air. I am going to inject it right into there. Flip it upside down and then pull 0.5 of the antibiotic. Get out the bubbles. Great. Gonna scoop it up. Now this is an IM injection, so we could do this in the deltoid, the vastus lataris, the ventrogluteal, or the dorsogluteal, and we're going to do that in the deltoid today. So I would find the acromion process and go 2 finger widths down, and that's where I would inject. So I would first clean the site real well, making sure I cleaned all the vial tops before I did anything also. Okay, now using the Z-Track method, I am going to get ready to inject. I am going to pull the skin over, go at a 90-degree angle, straight in, inject slowly for about 10 seconds. Great. Scoop this back up, inject or put it in the sharps container. Apply any bandages. If the patient experiences any GI upset, to let me know, like nausea, diarrhea. There may be a little tenderness as well. And that is that for that medication. Just a little side note, I would have ensured with another nurse the correct measurements because it is a high alert medication for the insulin. All right, now I'm gonna gather all my supplies, throw away, remove my PPE, wash my hands, lower the bed. Do you need anything else? No? Great, I will go document these in the MAR, and I will be back to double check on you in about 30 minutes. Thank you.